breathe freely at last. Because the vortex holding chamber ensures more of your medication spray reaches your lungs. Used without a holding chamber, a medication spray works on the principle of press and breathe in. In other words, you must breathe in at exactly the same time as you press the spray. This kind of coordination is often difficult, particularly for children and the elderly. If it's not properly performed, a lot of medication can be lost on the way to the lungs. The vortex holding chamber overcomes these hurdles. The vortex enables the finer medication droplets to be inhaled one breath at a time, whilst retaining the larger droplets in the chamber. In this way, undesirable side effects in the mouth and throat can be avoided. The vortex's cyclone twist principle supports the transportation of the finer droplets. Now let's learn more about the vortex and how it's used. The vortex is an anti-static aluminium chamber. The anti-static effect helps ensure a consistent dosage and increases the amount of medication that actually reaches the lungs. You'll find a universal connecting ring for the medication spray at one end of the chamber. The mouthpiece is at the other end of the chamber and includes a valve. A cap over the mouthpiece helps to promote hygiene and also protects the mouthpiece. Before you use the vortex in an inhalation session for your baby or infant, take the protective cap off the mouthpiece and check the vortex for foreign objects or damage. Then attach the appropriate mask to the mouthpiece. Shake the medication spray before use. Remove the protective cap and insert the spray into the blue connecting ring. The vortex is now ready for inhalation. Place the vortex with the mask gently over the mouth and nose of your baby or infant. Make sure that it fits snugly before releasing a puff of spray. The medication droplets can now be inhaled at leisure. Release only one puff of spray into the chamber per application. Should you need more than one puff, repeat the complete procedure. After the inhalation session, remove the spray from the blue connecting ring. Children under the age of 18 months need to take about 4 to 6 breaths to inhale all of the medication droplets in the chamber. Children older than 18 months are likely to need 2 to 4 breaths. 2 different types of mask are available for the little ones to use: the smaller, Mary the Ladybug, and the larger, Felix the Frog. They provide a bright splash of color and help to make inhalation more fun. So, as your child grows, you can change the mask. The one-handed operation aid helps to make operation simpler still, particularly when using with babies. The aid enables a person to hold the vortex and trigger the medication spray at the same time with one hand. To do this, simply push the one-handed operation aid onto the vortex from the back. Shake the medication spray before use, remove the protective cap and insert the spray in the blue connecting ring. Position the spray so that the fastening element of the one-handed operation aid locks in place over it. Then close one hand around the vortex so that your fingers are resting lightly on the one-handed operation aid. Now place the vortex with the mask gently over the child's mouth and nose. Trigger a puff of spray and let the child gradually breathe the medication droplets. The best way for adults to inhale is through the mouthpiece. Children should also be able to inhale with the mouthpiece from the age of about 4. Grip the mouthpiece between your teeth and press your lips firmly around it. Press once to release the spray and breathe in slowly and deeply, before briefly holding your breath to give the aerosol droplets a chance to settle in your lungs. Finally, breathe out slowly through the mouthpiece. When the valves open, this indicates that you are breathing out. After the inhalation session is ended, clean the vortex. First, remove the medication spray and the accessories used. Then, just pull the mouthpiece off. Make sure that the protective cap on the mouthpiece is open. Clean the vortex carefully in lukewarm water with a little dishwashing liquid before rinsing it thoroughly with clean water. Then allow the parts to dry. Alternatively, you can clean the vortex in the dishwasher. Be sure to select a program with a temperature of at least 50 degrees Celsius. The vortex should be disinfected once a week or sooner if it's visibly dirty. To do this, either use a steam disinfector or place the vortex in boiling water for 5 minutes. Store all of the parts in a dry, clean place. VORTEX, the inhalation aid with an aluminium chamber for treatment that works.